OBUASI, made up of the municipality and OBUASI East District, is a well-known gold mining hub which has for years not only attracted an influx of people from across Ghana and even beyond, but also created fertile environment for mosquitoes to breed because of the numerous pits dug for gold and other factors. This means the few healthcare facilities within the enclave were continually kept under severe pressure, with malaria as the main cause of hospital attendance and admissions, while the main corporate employer in the area, Anglo-Good Ashanti, bore the brunt of high incidence of absenteeism and low productivity among its workforce. This necessitated the establishment of Agamal, a charity set up purposely to plan, implement and coordinate to fight the disease and its high burden. This drive, according to the director of Agamal, Samuel Esedweje, led to the introduction of the indoor residual spraying, or I.R.S, first on a small scale using the mine and its immediate surrounding communities as pilots.
The initial objective of this program was to reduce malaria incidence by 50% in the first 2 years. That is starting in 2006. It was expected that by 2008, malaria incidence would have come down by 50%. But due to the strategy and other interventions that were put in place, we were able to record 74% reduction in malaria incidence in the first 2 years. That made it very successful. And then it was recommended to the National Malaria Control Program at that time, currently the National Malaria Elimination Program. And with the support of the government, we had some resources from the Global Fund to expand this program beyond what the mine was doing.
But over time and based on the huge success rate at the pilot level, with the coming on board of the Global Fund supported by Anglo-Good Ashanti, the indoor residual spraying intervention was scaled up to all communities in the OBUASI enclave. GBC News therefore went on a mission to ascertain the level of this intervention's impact in Ghana's malaria elimination effort toward the 2030 target. Even though the people know the indoor residual spraying intervention is about only the spraying of approved chemicals in rooms and walls conducive for mosquito breeding, our news team learned that scientists at the entomology laboratory at Agamal have to first go through mosquito breeding from the vector stage to adulthood to study their characteristics as well as determine the chemical with the best efficacy to destroy the malaria-causing vector. And when satisfied, the gang of sprayers set off for the main activity, which is to spray homes, open places, churches, mosques, among other identifiable spots throughout the communities. Adomi Abra, one of the beneficiary communities in the OBUASI East District, two beneficiary landlords, 57-year-old Mr. Ahmed Nkrumah and Mrs. Tebian Ponsa, shared the experiences with the intervention so far.
I experienced my catastrophic, problem with malaria about 20 years ago when the indoor residual spraying has not started. We were at the mines when 4 of all my children were down with malaria. So when they were sent to the AG hospital, 3 of them were admitted whilst 1 was treated and discharged. So the doctors were very much annoyed with me that I wasn't taking good care of my kids. But by God's grace, the 3 who were admitted were also treated and discharged. But just about a year later, the company introduced the I.R.S. that since that time, I think about 19 to 20 years ago, as a family, none of us has gone to the hospital for malaria.
Apart from malaria, also, Emma, yana ye wo wira no sei ye wo mo anketenkete se ntefre sa efiewurafo no so mo be spray sa mo anu nyina mo evanish a ye hunu omo bium enti omo ba eye.
With a population of about 104,000 and 12 approved public and private healthcare facilities, GBC News then followed up to the 2 major referral facilities in the area. These are the AGA Hospital, now AGA Health Foundation, and the OBUASI Government Hospital. Using a graph, a chart and data, the Executive Director of the AGA Health Foundation, Dr. Kojo Nim, and the Medical Superintendent of the Government Hospital, Dr. Kojo Asamoah Akujeke, traced the trend and history of malaria cases at their respective facilities from before introduction of the I.R.S. to date, showing that consistently for some time now, malaria no longer tops the list of 5 causes of OPD attendance and hospital admissions.
Maximum you are having in a month will probably be in the hundreds. So out of an attendance of, let's say, 12,000 plus, and you are looking at a maximum of 400 cases of malaria, that is significant. And if you are looking at OPD attendance only, and you are having malaria not being amongst the top 5 causes of disease, that is also something that is impressive for OBUASI.
When we look at our 4-year trend, malaria dropped from 2018 from top of the list to 3rd. And by this, I mean the uncomplicated malaria. And then in 2020, even when OPD cases in general dropped because of the COVID, malaria came to 6th position. And this 6th position has been maintained in 2021. And we believe that it will drop further.
The Municipal Director of Health, Madam Yamenu, noted that a nationwide scale-up of the indoor residual spraying supported with effective use of the long-lasting treated insecticide net, eliminating malaria in Ghana by the 2030 target is highly feasible.
If you have a baby and the baby is sleeping, how does the baby know that there's a mosquito? But because the room is safe, you can put your baby in the room. We are doing things outside. Definitely there are mosquitoes outside. And that is why I'm saying that they should scale up the work of I.R.S. And then at the tail end, we add all other interventions to complement it so we can reach our target. It's very feasible if we put all hands on deck.
The Director of Agamal, Mr. Esiedu, assured that with sustained funding by the Global Fund, the I.R.S. intervention will continue to be free of charge for the catchment communities.
We also have opportunity to spray the mosque and the church because there are night activities. Any place that people spend the night, due to the behavior of the mosquito, you know that as people relax, take a break, and in their still moment, that is when the female Anopheles would like to take a blood meal. So any place that people spend the night, we do spray, and the church and the mosque are inclusive.
Reporting for GBC News, Nicholas Osewusu, OBUASI, Ashanti Region.